Tingnan na. Magandang araw po muli mga classmate. Magandang araw aming mga tagapakinig. Magandang araw, Doc. So, pagpapatuloy po natin, ang ating topic ay ang tungkol sa blood o swe. So, what is blood? The meaning of blood in Chinese medicine is different from its meaning in Western medicine. So, magkaiba po yun sa Western. In Chinese medicine, blood is itself a form of qi, a very dense and material one. So, form of qi and blood. Blood is inseparable from qi itself as qi infuses life into blood. Hindi mo po pwedeng paghiwalayin ang blood at saka qi. Without qi, blood would be an inert fluid. So, magkasama po lagi yan. Source of blood. Blood is derived mostly from food qi produced by spleen. Siya po yan yung mga kinakain natin. Nabababa sa stomach, iga-grind, katulong ang spleen. The spleen sends food qi upwards to lungs. Through fusing action of lungs qi, this is sent to heart, where it is transformed into blood. So, ganun po yung nangyari. Pagkakain natin, ida-digest niya, magiging food qi, tapos itataas niya sa lungs, then yung lungs sent to heart, and transform into blood. Siya na po yun yung isa-circulate ng heart sa different parts of the body and organs. Okay. Source of blood. Stomach is the middle burner. Opens onto upper burner, receive qi. Secret dregs, evaporate fluids, transforming them into a refined essence. So yung mga hindi na po kailangan ng katawan o yung untransformed good qi, syempre ibababa ng ating stomach sa small intestine, then to colon, then ilalabas po ng ating katawan, stool. This pours upward toward lungs and transform into blood. So, yung pagkagaling po sa spleen stomach, tulad po sinabi natin kanina, toward tataas sa lungs, then lungs transform into blood, then go to heart and circulate. Okay po. So, the spleen and stomach are the main source of blood. Yung kinakain natin. Kaya napakahalaga na healthy food ang kinakain para yung napoproduce na blood ay healthy. Lung qi plays an important role in pushing food qi to the heart. This is an example of the general principle that qi makes blood move. Food qi is transformed into blood in the heart. This is one aspect of the principle that the heart governs the blood. Yan po, from the spleen, magiging food qi, then up to the lungs, dadalhin sa heart, then heart, si blood. So yung ano po yun, andun yung kidney, siyempre katulong po yung kidney essence at saka yung original qi para maging blood. Magmimix po yun. Okay, two other important feature in manufacture of blood. So transformation of food qi into blood is aided by original qi. So yung galing po sa ating kidney essence. Kidney store essence which produce marrow. This in turn generates bone marrow which contribute to making blood. So yun po yung role ng kidney store essence. Okay. If qi is not exhausted, it returns essence to kidney to be transformed into essence. So yun, bumabalik siya sa kidney, tapos transform ulit sa essence, naka-imbak ulit doon. If essence is not depleted, it returns essence to liver to be transformed into blood. So kung hindi masyadong na-deplete, punta ulit sa liver at transform into blood. Kidney plays important role as they store essence and they are source of original qi. Kasi nasa kidney natin nakalagay ang original qi. Okay. So blood is generated by interaction of post-heaven qi. Ito yung mga kinain natin, mga food, of stomach and spleen, yung source of food qi. And pre-heaven qi, kidneys plays a role in transformation. So to nourish blood, siyempre tonify the spleen and kidney. So yung makikita po natin, yung spleen stomach, siya yun ang nagpo-produce ng post-heaven qi, yung food. Yung kidney qi naman, nasa kanya naka-imbak yung pre-heaven qi. Then magko-combine to, ito po yung magiging blood. Post-heaven and pre-heaven sources of blood. Kaya kung may problema sa blood, dapat mong itonify muna ang spleen, stomach, and kidney. Okay? O, function of blood. Yung main function po niya, siya yung nagdonori sa ating katawan. Complements nourishing action of chi. Blood is dense form of chi. Flows with it all over the body. So, siya din po yung moistening function. May moistening function which does not have. Blood ensure that body tissue do not dry out. Yan. Kaya kung kulang tayo sa blood, siya yun yung nagda-dry out yung mga part ng katawan natin. Okay? Example, liver blood moistens eyes and sinews so that eyes can see properly. Sinews are flexible and healthy. Kaya kung kulang tayo sa blood, na pangunahin ang liver ay namamahala sa ating eyes, yun, lumalabo yung mata natin. So, liver blood moistens skin and hair, ensuring that skin is not too dry, hair remains shiny and healthy. Kaya kung liver blood deficient tayo, magkakaroon ng problem ang ating shiny hair. Heart blood moisten tongue. So, sa tongue naman po ang heart blood. Okay po, thank you.
Thank you very much, Ma'am Mildred. Kung wala pong questions, we will continue with tongue diagnosis. Okay, we are still on tongue body shape. No? Now let's talk about the sunken areas, yung mga nakabaon. Okay, may depression. Some areas of the tongue can appear to have sunk downwards. This indicates a condition of qi deficiency in the organ that is reflected in this area of the tongue. The depression in the tongue surface can sometimes only be seen immediately after the person has presented their tongue. And then the area fills up and the depression is no longer visible. It is sometimes necessary to get the patient to extend their tongue a couple of times to be sure that you have observed the depression correctly. An area of the tongue may only collapse after the tongue has been extended for a while. In both cases, this will most typically be seen in the area corresponding to the lung or the spleen and stomach and is indicative of qi deficiency in these organs. If the root of the tongue is sunken, this can be a sign of kidney jing deficiency. Uncontrolled movement and stiffness. There should be flexibility and movement in the tongue. If the tongue movements are involuntary, this may be interior wind. Okay, this may be interior wind. And this will cause the qi to move chaotically or the spleen failing to control the muscles. When the spleen does not control the muscles in the tongue can quiver. Sometimes the tongue will begin to quiver after the person has had their tongue extended for a few seconds. It is as if the spleen is no longer capable of keeping the tongue still. In the same way that a light wind will cause a flug to wave from side to side, high winds will make the cloth of the flug hard and stiff. The same applies to tongue. Interior wind can make the tongue sway from side to side or result in a tongue that is rigid and inflexible. If the tongue deviates to one side, this can be due to the channels on one side of the body being excess, no? Wind, it can be wind or phlegm, or the channels on the other side of the body being deficient. A flaccid tongue, especially pag swollen, it indicates qi deficiency or phlegm. Now let's talk about flaccidity. If the tongue seems limp and lifeless, this may be due to a lack of fluids or blood causing the tongue to wilt. So there may therefore be qi deficiency or blood deficiency. Alternatively, heat may have damaged the fluids. The color of the tongue will determine whether it is blood deficiency and or a qi deficiency condition, or yin deficiency or heat. In the first two cases, the tongue will be pale. In the latter two cases, the tongue will be red. Now let's talk about the length of the tongue. The yang nature of heat is expansive. This can cause the tongue to become longer. Kaya mahaba yung tongue ng mga may heat. No? At the same time, heat damages the fluids, and this can therefore cause the tongue to shrink, resulting in a short tongue. Cold has a yin dynamic that makes things contract. Cold can therefore also result in a tongue that is shorter than normal. The difference between a tongue that is short due to cold and one that is short due to heat will be seen in the color of the tongue. So yung basahan talaga is the color of the tongue. Heat will result in a short tongue that is red, whereas cold will manifest with a pale and short tongue. Now let's talk about cracks. Cracks are often, but not exclusively, a manifestation of yin deficiency. Body fluids nourish and moisten the tongue in the same way that rain moistens the soil. If there is too little rain, of course, yung surface ng earth will crack. And if there is too little body fluid, the tongue surface cracks. The shape and distribution of the cracks will depend on the type of yin deficiency involved. Yung depth and size of the cracks will say something about how serious the situation is and how long it has existed. So if you have a deep, long, and multiple cracks, they signify a more deep-seated imbalance than single, short, shallow cracks. A very swollen tongue may look as if it is cracked, but this is because the tongue is wrinkled and creased. The patient can be asked to pull the sides of the tongue outwards. If the cracks disappear, the tongue is just swollen and not cracked. By pulling on the side of the tongue, you can also get an idea of the depth and thus the severity of the cracks. A short crack in the middle of the tongue indicates a deficiency condition in the stomach or spleen. If the crack and the area around it is red and lacks coating, this is a sign of stomach yin deficiency. If the area is normal or pale colored and then my coating, it will not be yin deficiency. But since my coating pa, it's called spleen and stomach qi deficiency. If the crack is deeper or wider with a sticky yellowish coating, it may look as if the crack is furry. It is a sign of stomach fire or phlegm heat in the stomach. So here are examples of the tongue with cracks. Okay. If there are more irregular or transverse cracks in the central area of the tongue, it will be a manifestation of stomach yin deficiency. If the cracks are more extensive and cover the entire tongue, this indicates stomach and kidney yin deficiency. A longitudinal crack along the middle of the tongue with several transverse cracks extending out from it, this reflects stomach and kidney yin deficiency. A crack that runs all the way down the center of the tongue and out to the tip shows that there is a constitutional weakness and the person can have a tendency to develop heart imbalances. Two diagonal cracks on the front third of the tongue behind the tip is a sign of lung yin deficiency. The cracks may be remnants of an old condition, such as a severe respiratory disease in early childhood that damaged the lung at that time. Short transverse cracks on the sides of the tongue are a sign of spleen qi and yin deficiency. Okay? And lastly, we have the veins on the underside of the tongue. If the veins on the underside are swollen or knotted, it indicates that there is blood stagnation. If the veins are very flat and pale, there may well be blood deficiency or qi deficiency. Thank you very much for your attention. Are there any questions? Okay, kung wala na
Sinasabayan kita, Dok.
questions, we will...
Tinitingnan ko yung tongue ko eh. At least may development na.
Nag-change, no?
Opo, pag gumagaling kasi, Dok, nawawala yung crack.
Mm-mm.
Nawawala po talaga siya.
Ramdam naman eh, kasi masaya yung boses mo. So that
Pati
means
po dun sa, ano, sa back.
yung essence mo and chi are good, so you'll have a healthy mind. Okay?
Po.
So now you will discuss po 5-palm heat. Nasa ano po din tayo? Feeling of cold and fever. Good afternoon po ulit, Ma'am Mildred.
Good afternoon po muli. Ang ating pong topic ay Fever 19, 5-palm heat. 5-palm heat. This is a feeling of heat in the palms, soles, and chest, which is also sometimes called 5 center heat or 5-heart heat. This may or may not be accompanied by an actual fever. It is usually accompanied by mental restlessness, night sweating, and insomnia. This is frequently seen in practice. However, it sometimes may manifest only in the soles and palms or palm and chest. Yin deficiency of any organ may cause 5-palm heat: lungs, heart, liver, spleen, kidney, stomach, halos lahat na palang organ yan eh. However, there are other less common possible causes of 5-palm heat, including blood deficiency, yung kulang ng dugo, latent heat in lesser yin, and liver fire. In blood deficiency, 5-palm heat is experienced mainly in the afternoon and is accompanied by other symptoms of blood deficiency. This occurs almost exclusively in women. So, 5-palm heat, latent heat in the lesser yin, is characterized by heat in the kidneys and is frequently seen in myalgic encephalomyelitis. Post-viral fatigue syndrome. The main manifestation are a low-grade fever or feeling of heat in the afternoon or evening. Mainit yung pakiramdam. Tapos, pag umaga naman, feeling of cold in the morning. Tapos yun, nahihilo siya, nagkakaroon ng tinnitus, at paggabi naman, nagkakaroon ng night sweating. So, pag liver fire also may cause 5-palm heat. Yun, nakakaramdam ka ng mga pag-iinit sa iyong mga palad, sa paa, sa dibdib. Not frequently. The symptoms will be accompanied by other manifestation of liver fire. So, yin deficiency of any organ, this is the most common pattern. Blood deficiency, more common in women and occurs more frequently in the afternoon. Latent heat in the lesser yin occurs more frequently in the evening with low-grade fever. Pag liver fire naman po, severe po yung 5-palm heat, yung nararamdaman ng init na yon. Tsaka sudden onset, not uncommon. So yun po yung summary ng 5-palm heat.
Thank you very much, Ma'am Mildred.
Thank you po.
Okay, next we go to pulse diagnosis. This time, we're going back to the overview for the benefit of those who just signed up. No? Pulse diagnosis is regarded as a precise, but at the same time, esoteric diagnostic tool. Some acupuncturists have shied away from it because they had not had teachers and textbooks that have presented it as an accessible tool that is indispensable in practice. Kaya wala tayong ganyan na ano, no? So I think this is more of like self-study. Despite its reputation, pulse diagnosis is not difficult to learn. Even with very little practice, it can provide vital diagnostic information to the novice. With practice and hands-on instruction, the novice can soon develop their skills and gain a deeper insight into their patient's physiological condition. Most patients we see present with complex conditions. So it consists of several conflicting patterns of imbalance at the same time. This creates the need for a bird's eye perspective. Pulse diagnosis can be used both to refine and to simplify a diagnosis. We can use it to get a deeper insight and thereby a more accurate diagnosis. An example of this could be a client who suffers from fatigue and shortness of breath. Their pulse is weak, so we know that it is a deficiency condition. By feeling whether the pulse is weaker in the front or the rear position on the right wrist, we can determine if there is lung qi deficiency or kidney qi deficiency. But we can also move in the opposite direction and use the pulse to take a step back and clarify a situation. If the symptom picture is complex and messy with conflicting symptoms, you can quickly feel the pulse to answer questions like, is there heat or cold? Is it an excess or deficiency condition? Is it yin or yang? Pulse diagnosis has the strength to be utilized on its own. Where other changes in the body's physiology need to be compared with other symptoms and signs, or to be corroborated by asking supplementary questions, the pulse can be used alone. Kaya pala there are practitioners pulse lang ginagamit. A deep and weak pulse in the rear or shear position is a sign of a kidney deficiency condition. A rapid pulse is a sign of heat. Always po talaga yan, may heat. Tongue diagnosis and HARA or abdominal diagnosis can be used unaccompanied, but not to the same extent as the pulse. Learning to take the pulse is not dissimilar to learning to play a musical instrument. No? It is easy to learn the most basic aspects, especially with a good teacher, but it takes years of practice to attain a high level of skill. Sabi nga ni Dr. Palanca, 8 to 10 years. O, diba? Yon, kailangan frequent practice, no? And
para mas matandaan.
Yeah, and kailangan tinuturo mo siya araw-araw or turuan mo yung sarili mo. Yun nga lang, parang ang hirap ituro yung naramdaman mo sa isang estudyante, no? 'Di ba? Do you agree?
Opo.
Mahirap.
Kaya at least yung basic po sa ano, 'di ba yung tinuro natin sa yin and yang, na alam niyo yung heat and cold para maramdaman nila yung mabilis mabagal tapos tatapat sa mga organs.
Yeah. As with a high level of proficiency, the rest of us have to work harder to achieve these skills. Kaya walang shortcut. Everyone, though, whether they are natural prodigies or have more mediocre talents, will need to practice. Kung walang practice, wala talaga mangyayari. So, the only way to do this is to place your fingers on the radial artery of the wrist a great many times. No? So aside from constant practice, kailangan you have to study and to commit to memory the diagnostic interpretations of the various pulse qualities. For example, yung full, replete pulse signifies na it is excess or a Shi condition. History. Pulse diagnosis has been discussed in Chinese medical texts ever since Wang Dinajing, Su Wen, the Yellow Emperor's classic. The book describes how the pulse is felt at 9 locations on the body. The positions are directly related not only to the specific channels, but also to the 5 Zang organs and to specific areas of the body. In the Nanjing, we can recognize the pulse diagnosis that we use today with 3 positions on each wrist and 3 depths. Yan po yung common na ginagamit ngayon. The 3 positions reflect the 3 jiao, and specific organs are attributed to the different positions. There have been varying definitions over the following centuries of what the different positions relate to. No? But there has always been a general consensus on the relationship to the 3 jiao. Okay? Now let's talk about the physiology. The pulse that we feel under our fingertips is blood, shui, no? That is being circulated by the qi. So hindi magsi-circulate ang blood kung walang qi. Shui can be more easily felt than qi because mas yin siya, more physical. Qi and shui have a close relationship. Qi is the commander of blood and blood is the mother of qi. This means that we can perceive the qi via the blood. We can perceive changes in how the artery feels when there is a qi imbalance, because changes in the qi will affect the way blood moves through the vessels. Blood is created from Gu Qi and Yuan Qi, original Qi, di ba? Driven by Zong Qi and guided by Heart Qi, whilst the liver ensures that Qi flows freely and unhindered throughout the body. This means that imbalances in the stomach, spleen, kidney, lung, liver, heart, and sanjiao will be felt directly in the pulse quality and strength. Thank you very much.
Yung ano lang sa pulse doc tulad nung nabanggit natin, mahalagang matanong nila kung may iniinom na gamot kasi makaka-apekto po dun sa pulse.
Yes. Kaya nga eh. So ngayon, master na ni Ma'am Mildred.
Malaking tulong po talaga yung pulse, tapos sasama mo yung tongue. O, konti na lang sa interrogation para meron kang exact talagang patunay na yung diagnosis mo ay tama.
Yeah, paulit-ulit lang. Buti nalagyan na natin to sa YouTube. Okay, anyway, after pulse, punta naman tayo ngayon sa differential diagnosis, LAMP TCM foundations. Ma'am Mildred, again. Okay.
Magandang araw po muli. Liver yin deficiency with empty heat. TCM foundation 183. So, liver yin deficiency with empty heat. Etiology, diet lacking nourishment. Yan, yung mga hindi healthy yung kinakain. Excessive drugs, yung umiinom po ng maraming gamot. Chronic illness, matagal na may sakit. Tapos yung mayroong excess sexual intercourse, sobra-sobra. Makipag-sex. Over-exertion, yung sobrang, halimbawa yung nag-gym, sobrang nag-jogging. Underlying accompanying pathology, nagkakaroon po siya ng kidney deficiency, pwedeng magkaroon ng liver blood deficiency. Yan. Sign and symptom po, makakaramdam sila ng pagkahilo, numbness, tingling of the limbs, yung parang may tinutusok-tusok. Insomnia, di makatulog, magbablur yung vision. Nagkakaroon ng visual floaters, parang nakakakita ng mga puti-puti. Tapos nagda-dry din po yung mata. Paggabi, hirap na yung nagkaroon siya ng poor night vision. Tapos, ang menstruation niya ay konti-konti. Or heavy bleeding if empty heat pronounced. Or minsan pag nag-mens, parang sobrang lakas. So, nagkakaroon po siya ng dull, pale complexion, redness around the cheekbone. Tapos, ang kanya pong muscle ay mahina at nagka-cramps. Yung mga kuko, brittle. Tapos, yung skin very dry. Pati yung hair. Tapos, madalas po itong nagkakaroon ng depression, anxiety, tapos nakakaramdam ng init sa gabi, namamawis, ayun, 5 fan heat, nararamdam po niya yung mga palad, yung mga paa, tsaka dibdib. Pag hinawakan po natin ang kanyang pulse, floating, empty, slightly rapid. Yan, kasi empty heat. So, ang tongue po niya ay red without coating. Wala na pong coating. So, ang treatment principle po natin, kailangan nating enrich yung yin. Patasin natin yung yin kasi andun yung blood. So, nourish blood at i-cool po natin yung heat kasi bumaba nga yung yin kaya tumataas ang yang. So, tusukan po natin ang kidney 6. Cools the valve pan heat para mawala yung mga mainit na pakiramdam. Kidney 1 para sa clear kidney heat. Spleen 6. So, ino-nourish po niya ang regulates liver and nourishes yin. Stomach 36, ino-nourish po niya ang blood. Kidney 6, nourish yin, clears empty heat. Tapos, extra point po ng Yu Yao benefits eyes. Gamitin din po ang kidney 2 abates kidney heat. Tapos liver 8, liver yin blood deficiency. Kidney 3, so 8.2 clears empty heat. Ren 4, nourishes kidney yin. Liver 2 clears liver heat. Needle with even method or drainage. For insomnia, so yung heart point po, heart 8, lung 11, heart 7, spleen 6 with supplementation. For steaming bone, stomach 36 po at bladder 43. And para sa liver, yin deficiency with empty heat. Arigato.
Arigato gozaimasu.
Gozaimasu.
Thank you very much, Ma'am Mildred. Okay, after differential diagnosis, punta naman tayo ngayon sa acupuncture patterns and practice. This time, we're going to discuss case history 2. Okay, let's now go to signs and symptoms. Receding gums and gums oozing pus. Okay. The first consideration po ng receding gums is deficiency of qi and blood. So we would be looking at a female patient. So aside from receding gums, you will have to check if the lips are pale, the gums are pale, if there is poor appetite, loose stools, weak voice, tiredness, blurred vision, dizziness, numbness or tingling of the limbs, palpitations, dull pale complexion, pale tongue, weak or choppy pulse. For receding gums, another differential would be stomach fire. So the gums are red, may mouth ulcers, bleeding gums, foul breath, burning epigastric pain, intense thirst with a desire to drink cold liquids. There will be mental restlessness, dry stools, dry mouth, mouth ulcers, nausea, vomiting soon after eating, sour regurgitation, foul breath, a feeling of heat. The tongue is red with a thick, dry, dark yellow coating, and the pulse is deep, full, and rapid. Another differential would be kidney deficiency with empty heat. So we think of an elderly. So aside from receding gums, there will be bleeding gums, dizziness, tinnitus, vertigo, poor memory, deafness, night sweating, dry mouth at night, 5-pound heat, a feeling of heat in the evening, malar flush, menopausal hot flushes, thirst with a desire to sip fluids, lower back ache, ache in bones, nocturnal emissions with dreams, constipation, dark scanty urine, infertility, premature ejaculation, tiredness, depression, anxiety, insomnia, excessive menstrual bleeding dahil sa empty heat, red tongue without coating, floating empty, and rapid pulse. Okay. Apart from the stomach, the kidneys also influence the gums. So remember this, so stomach and kidneys. Loose teeth are a sign associated with a kidney deficiency in Chinese medicine, but teeth become loose as a result of gum disease. Next, we talk about gums oozing pus. The first consideration would be stomach fire. Okay, so aside, there will also be tooth abscess, red and swollen gums, bleeding gums, toothache, foul breath, burning epigastric pain, intense thirst with a desire to drink cold liquids, mental restlessness, dry stools, dry mouth, mouth ulcers, nausea, vomiting soon after eating, sour regurgitation, foul breath, a feeling of heat, tongue is red with a thick, dry, dark yellow coating, and the pulse is deep, full, and rapid. Okay, the other two considerations for gums oozing pus would be invasion of wind heat with toxic heat. So look for swollen glands, bleeding gums, aversion to cold, sore throat, fever, tonsillitis, tonsils, oozing pus, headache. Tongue is red on the sides with red points and a yellow coating. Pulse is floating, rapid. And the last consideration would be severe deficiency of qi and blood with toxic heat. So there will be chronic recurrent bouts of gums, oozing pus, ulcers on the gums that are slow to heal, poor appetite, loose stools, weak voice, tiredness, blurred vision, dizziness, numbness or tingling of the limbs, palpitations, dull pale complexion, pale tongue, weak or choppy pulse. Thank you very much for your attention. And
Thank you, Doc.
Ma'am Mildred, meron ka pang energy?
Meron pa po, ayun na si Ma'am Nitz kasama natin.
Okay. Baka si Ma'am Nitz gusto mag-take over. Ma'am Nitz,
Opo.
can you... Oo, kasi medyo wala ng boses si Ma'am Mildred. Oo. The last topic po, we'll go case history 2 for asthma.
Hello, Ma'am Nitz. May kausap ka pa po.
Hello,
Okay,
hello
po.
po.
Okay po.
Good afternoon, everyone. Hindi ko lang alam kung medyo mababasa ko. Our topic for case history, part 2, number 25, asthma. Okay. A 42-year-old woman had been suffering from allergic asthma since childhood. The asthma had got better during adolescence, but it became worse when she was about 32. At that time, her asthma started after an episode of influenza that then turned into bronchitis. She had 3 courses of antibiotics, but was left with a cough productive of profuse sputum, wheezing, and breathlessness. Ipakasya. She was prescribed inhalers of steroids, yung Pulmicort, and B2 agonist, Recreational. Yan, Recreational para sa husband ko. All these symptoms seem to point clearly to a late onset, intrinsic, non-allergic type of asthma. However, there were other factors that pointed also to an early onset in extrinsic allergic type of asthma, that is, the period of allergic asthma during childhood, the onset of asthma attacks on exposure to dust, high levels of IgE, and the fact that she also suffered from allergic rhinitis. Okay. This case history is a clear example of a case of asthma that is mild allergic and non-allergic. In her case, although the asthma was originally the allergic type, she did also have phlegm. Her pulse was tight in general and weak on the left rear position. Her tongue was slightly pale and bluish purple. So parang may stagnation din or cold. Okay. Ang diagnosis nito, this is a clear example of asthma that started as an early onset allergic type and then combined with a late onset type. The main pathology was phlegm in the lungs, that is swollen tongue, slippery pulse, and expectoration of mucus. A deficiency of the lung and kidneys defensive systems with wind and phlegm in the lungs. There was also spleen deficiency which contributed to the formation of phlegm. Treatment principle: treat the root by tonifying the lung and kidneys defensive system, the spleen, expel the wind from the bronchi, and resolve the phlegm. She was treated only with acupuncture. Although she would have benefited from herbal treatment, she specifically declined it. Hindi siya nag-herbal. Acupuncture. The treatment was carried out over several years and is still ongoing. The acupuncture points were selected from the following: lung 7 and kidney 6, which is directing vessels opening points, yung kidney 6. And then ren 4, kidney 13, spleen 6, kidney 7, bladder 23, backshoe of the kidney, ren 12, bladder 20, bladder 13, lung 5, and stomach 40. Okay? Explanation. Lung 7 and kidney 6 open the directing vessel, which is called the renmi, which tonifies the lung and the kidneys. Okay? And 4, kidney 13, spleen 6, kidney 7, and bladder 23 tonify the kidneys. Okay? Ren 12 and bladder 20 tonify the spleen. Bladder 13 tonifies the lungs. Okay? Lung 5 and stomach 40 restores the descending of lung qi, open the chest, and dissolve phlegm from the lung. Okay? So, prognosis and prevention. The treatment of allergic asthma necessitates a long period of time because the disease is always based on an inborn deficiency of lung and kidneys defensive system. Okay? In most cases, the treatment may need many months, if not years, sobrang tagal na, no, to produce lasting results. Hindi bigla-biglaan siya. Both acupuncture and Chinese herbs are equally effective in combination or given independently. Kapag yung mga bata can be treated soon after the development of the disease, the course of treatment will be much shorter. So, mas maaga, mas maganda, di ba? If the patient is on bronchodilator, inhalers such as Ventolin, it is not necessary to suggest they stop them, as the need to use them will automatically decrease as the treatment progresses. So, hindi bigla-bigla, huwag tatanggalin, makinig po sa doktor minsan. As for oral steroids, it is much better if the patient can reduce them very gradually as soon as possible, as they have many side effects. Palang side effects ng steroids. The main one being that of inducing a deficiency of kidneys in the long term. Okay? As allergic asthma is based on deficiency of kidneys defensive system, oral steroids, although affording immediate relief, can only make it worse in the long term. So remember po nyo yan. Okay? If asthma is accompanied by eczema and the patient is using steroid creams, mga pampahid, this should be stopped. Kailangan stop na kagad. This means that the eczema may temporarily become worse and the patient should be warned. Okay? This aggravation can and should be counteracted, however, by the use of herbs externally as described above. Doing this is important in order to gain the patient's confidence in the treatment. Okay? Kailangan maganda yung advice patient. After successfully treating a patient with asthma, it is important to take preventive measures to avoid its recurrence. Okay? Adults should be advised to have enough rest and avoid excessive sexual activity. Remember, children or their parents should be advised to avoid eating excessive amounts of dairy foods, sweets, and greasy fried food. Mahilig sa mga prito, mga matamis. They should also take great care to avoid exposure to cold and wind without proper clothing. So, hindi maganda yung naguhubad, mainit, malamig, hangin. Okay? Then, both adults and children should be treated immediately at the first sign of invasion of external wind. because this may easily precipitate an attack of asthma in susceptible individuals. Okay, remember, if there is eczema, they should never eat shellfish, mga laman dagat, mga shell, mga sa shell, such as shrimps, prawns, crab, and lobster. They should also avoid eating spinach and mushrooms. Bawal din pala yun. Dairy products, greasy fried foods, spicy foods, and alcohol. Okay? Regarding naman sa acupuncture, reinforce the following points with moxa, unless there is yin deficiency, remember. Bladder 13, BU12, bladder 43 to strengthen the lungs defensive T system. Use these points in late August. So, ano po nyo to? Screenshot nyo. Bladder 23, REN 4, and kidney 16 to strengthen the kidney's defensive T system. Use these points in late October. Yan ang advice. Okay? Thank you very much for
Thank
your
you very
listening.
much, Ma'am Neets. So, any questions? We would like
Clear
to,
na po, Doc?
yeah, any comments?
Clear na po?
Yeah, clear na. So, thank you very much po sa lahat for joining us today, and especially sa mga presenters. So, enjoy your weekend.
Thank you, Doc.
Stay
Thank you,
happy and stay healthy. Thank you po.
Opo. Saraming natutunan po na apply sa mga katawan mismo.